Right. 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 Yeah. Yeah. So moving further, ma'am, you have been the chair of UNESCO Bioethics Committee, and I know even in India there's a large amount of relative importance that has been given to ethics and I would say bioethics and other things, which prompted ICMR and DHR to have a separate chapter on bioethics as well. Post COVID, especially, I mean, if you really see the kind of the clinical trials that have been actively involved over the years, there is something what we call it as CDSCO in India, Clinical Drugs Safety Compliance Organization, which has become relatively very strict on certain ICMR projects, underlining the scope. Even for example, even for the prophylactic measures, even if the drug intake is very minimal, the CDSCO clearance needs to be taken apart from the ethics clearance. So, what has been a major concern from a clinical setting, ma'am? What prompted researchers especially from India, because there were even some hospitals which I really don't want to name, which have been blacklisted and not considered, further, for applying for kind of grants. But ethics has really been given a big push in India over the years. Where are we really heading over the years in terms of ethics or probably bioethics, man? Yeah. Right. Thanks to wonderful genome editing technologies like CRISPR, I know we have a long way to go, at least in India, looking into those genome editing approaches, at least for therapeutic causes, because there are some good number of rare diseases, of course, which we also work. But right from bench to bedside, taking that uniformity, ensuring that the scientists meet the geneticists and geneticists meet the genetic counselors, and then there is a good amount of patient counseling, and from there bench to bedside, it would really take the number of years. But I still feel that there is a bigger hope, at least in the realm of CRISPR strategies, the genome editing strategies, that we have really a big hope. Yeah. uh, yeah. Yeah. I mean, yeah, yeah. I mean, Right, right, ma'am. I completely agree. I mean, one way, it's we are democratizing science or democratizing clinic from bench to the bedside, and at the same time, there are, of course, those very sensitive and yet very important streamlined ethics that we need to follow, so that it should be reachable to every corners of science or the patients. Yeah, that is absolutely need of the hour. Ma'am, when looking into your CV and wonderful profile, I was a bit intrigued with the fluoride debate. Fluoride debate. I was just wondering what was that, ma'am? Can you please highlight those? Right, 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 right. Oh, yes. Oh, yeah, wonderful, wonderful, ma'am. What a great honor. Yeah, yeah. I was also a bit intrigued on this, ma'am. Looking into your latest wonderful book and wonderful technologies that you have pronounced it and call it as digital biomics, and of course, multiomic based integration technologies. Where do you see this digital bionics? I mean, if you really talk about the cancer healthcare or even the complex diseases, or even for that matter, any rare diseases or any pregnancy related disorders. Where do we see all these kind of biomic technologies shaping up in lieu of One Health regime, ma'am? Yeah, right, right. No, that's right, right. Yeah, I also strongly vouch for that. But something on this similar lines, ma'am. Whenever I just forgot to ask you, whenever we talk about ethics or bioethics, don't you think in the realm of this robotic surgeries that we're all planning? I know it is easing a lot of surgeons' time and putting a lot of things off the shoulder. But there's a large amount of artificial intelligence being intruded into this. At the same time, I believe that it's going to be a major concern in the near future in terms of how effective the surgeons can really make certain effective surgeries, not just directly influencing artificial intelligence, but without AI as well, or without robotics as well. So where are we heading towards the AI and probably robotics in clinics, man? Yeah. Wonderful. Right. Wonderful, ma'am. Wonderful. Thanks. I'll just take a couple more questions. Thank you so much for your time, ma'am. If you really see again post-COVID, of course, gestational diabetes and endocrinology department has really taken heaps and bounds for obstetricians and as well as gynecologists, because there has been innumerable number of cases, and at the same time, there must be some prophylactic measures. There must be some kind of measures, not just from these particular pregnant women, or maybe the women during premenopause or postmenopause, or even in the reproductive health by and large. There must be a professional body, in my humble opinion, where there must be a kind of a society that is largely endorsed by maybe ICMR or maybe DHR, who can educate these particular masses largely from the rural areas. Although the government is really planning, I think a word of mouth, from the larger community health regime can really make wonders. So, I mean, I'll just give you one example, ma'am, because I mean, uh, uh, because I work at Amrita University. We work largely with Amrita School of Ayurveda, and Ayurveda doctors, they feel that we are being a bit underprivileged from probably from allopathy doctors, but we can really do wonders for endocrinology or maybe gestational diabetic patients from Ayurvedic regime. They feel that they think that they can really do wonders, but in India probably we are not yet really prepared at such kind of crisscross disciplines, merging allopathy, maybe Ayurveda, or maybe homeo, or maybe even Unani medicine as well. So where are we really into this, man? Yeah. Wonderful, ma'am. Ma'am, over the last 4 decades of your, scintillating experience, were there any occasions where you happened to disagree in an agreeable way with any of your colleagues? I mean, this is a common question I just ask, to my every guest, because the young generation, needs to take a leave from these senior, experienced people like you. Please. Right. Wonderful, ma'am. This was wonderful, ma'am. So these were some of those extempo questions I thought of asking you. Thank you so much. I am sure that there will be one or two questions from the audience if you can kindly oblige. Here, yeah, yeah, right, ma'am. Yeah, wonderful, ma'am. Thank you for that wonderful point. Yeah. Any questions from the audience, please? If not, ma'am, I take great pride and honor in introducing you to Professor Nirmal Keloia. I think you know sir very well. He's the president of ISSRF, and he was he's a professor emeritus and retired professor at Department of Zoology, and sir works on reproductive health. And I'm sure Loya sir might have one or two quick points, please, sir. Thank you. Yeah. Thank you so much, sir, for your time. Yeah, Professor Gajendra Singh, sir, please. Yeah. Wow. Thank you so much, ma'am, for those wonderful things. Any quick questions from the audience? If not, before you all switch on your camera for a wonderful photograph with ma'am, I think we all should give a kind of a standing ovation to Dr. Simmi Kharb and also all the women scientists as we celebrate Women's Day in a couple of days from now. I do Sciversation every month, at least one or two guests, and this has been some break so far. But this came at a wonderful August timing on the eve of celebrating the Sentinels of Science, especially for women biologists. And what more, could have been better, with Dr. Simi Karb's, wonderful lecture. I still cherish the wonderful hospitality that I had in 2020 when Nayaz introduced me to ma'am. I drove from Jaipur to Rohtak, and the wonderful ambience amidst a busy schedule. We had wonderful lunch and wonderful workshop during that day. And ever since, I've been very fortunate in exchanging emails and signs with ma'am. And I was really spellbound with her illustrious number of books, more than 14 books. And I would every time, tell my brethren that, this is Dr. Simika, not just a women clinician, but also a wonderful and a prolific scientist India has produced. Thank you so much, ma'am. Friends, this is kind of a standing ovation to ma'am and also all the women scientists, honoring all the women scientists like Simika, ma'am. Thank you so much. So I think there are some shy faces here who can switch on your camera. I'm a very good photographer. I can take a photograph. Please, yeah, please switch on your camera, please. Yeah, yes, yes. Shravya, Agu, yeah, Agu is there already. I'm sorry. Yeah, Raghav, Rakesh, if you can please switch on your camera, please. I'm just trying to, yeah, change this. How do I change this? Yeah, layout. Yeah, 1 minute. Yes, yeah. So yeah, no problem. Yeah. So thank you so much. Say cheese. Three, two, and one. Yeah. Thank you. Thank you so much, ma'am. Thank you so much for your time. Yeah, we're grateful. Thank you. Thank you, ma'am. So friends, this is Cybersation. We'll meet again during next Cybersation on 20th with probably with Anshuman Dikshit, who is a principal scientist at ILS Bhubaneswar. Thank you. Thank you so much. Thank you, ma'am.